If you were standing beside the Grand Canal in Dublin and you asked me where the nearest pub was, I'd tell you to continue on along by the canal till you got to the bridge, then turn right and go over the bridge onto Northumberland Road, continue on down Northumberland Road till you get to the next set of traffic lights, then turn left down Haddington Road and keep going down that road until you see the Beggar's Bush pub on your right. And you'd be able to follow those instructions because you understand the directions. You understand about left and right and go over this and turn at the traffic lights and so on. And it's the same with directions in the body, anatomical directions. We have to learn the different ways we describe directions in the body. So when you're talking to somebody else about things or talking to yourself about them, you'll be able to describe accurately where things are in relation to other things. But like everything else in anatomy, everything's got three names. So when you look into it, you're going to find all sorts of different names for directions, which it's good to know them, but we're not going to use them for craniosacral. For craniosacral, we're just going to keep it pretty simple and use very basic directions. Now, any lesson on anatomical directions is going to start with a body, a bit like this one, which is, well, let's face it, a bit boring. I always find that if you're learning something, it's always better to find something that will stick in your mind. Something like this. Oh, no, hang on, that's not going to work. That axe is going to make things really complicated. Well, maybe this. No, that's not going to work either. She's not in the right position. No, we'll have to go with this. This is called the anatomical position, and this model is like, just come back from aerobics or something like that. So the first direction we're going to do is called superior, and that's traveling away from the feet towards the head. Anything that's away from the head towards the feet, we'll call that superior. And the opposite of that, the other direction, is inferior. So anything that goes from the head to the feet is called inferior. So superior and inferior, first two directions. Now I'm going to have to get it to turn around so to show you the next two. And the first one is towards the front of the body, and that's called anterior. So going towards the front of the body, anterior, and then going towards the back of the body, posterior. So anterior and posterior. We've got superior, inferior, anterior, posterior. Now I just got to turn around to show you the next two, and that's anything traveling towards the midline of the body is called medial. Anything towards the middle is called medial, midline. And then anything away from the midline is called lateral. So you got lateral and medial. Now the thing to remember about these directions in the body is that they're linked to the body. Often people make the mistake of thinking, for example, that superior is just up, like the sky is superior and the ground is inferior. It's not, it doesn't work like that. It's linked to the body. So if the person's body is upside down, inferior is still towards their feet and superior is still towards their head. Now if we put our model in a different position, this is actually called supine. Lying on your back is supine, lying on your stomach is prone. Anterior is still to the front of the body, posterior is still to the back of the body, superior is still towards the head, and inferior is still towards the feet. So it doesn't matter which way the body is, the directions are always the same in relation to the body. So now let's put our model in a position that you'd come across in treatment. This is where the person's lying on their back and you're sitting at their head. So now superior is still towards the head, but it looks different. Inferior is towards the feet, but again it looks different. And then anterior and posterior are the same. Everything is the same, but just when you're you're viewing the body from a different position, it can be a bit confusing. So now let's put the model in another position that you'd find yourself when treating people. It's the other end of the body. This time you'd be at the feet, but it's going to be the same again, but just look a bit different. Anterior will still be at the front of the body. Posterior will still be at the back of the body. Inferior will be towards the feet, towards where you're sitting. And superior will be towards the head still, away from you. Now, the other way you can use the directions of the body is it can help you when you're looking at anatomical pictures. You can tell which way you're looking at them. This, for example, is a picture of the sphenoid bone. Now, this is a superior view, which means you're looking down onto the sphenoid bone. And if you know which way superior is, then when you see superior view on the diagram, you'll know which way you're looking at it. And then this is a posterior view of the same bone, but it means that you're looking at it from behind. So when you get it clear in your head which way the different directions are, then it makes it easier to understand the anatomical drawings. But there's more to it than that, because not every anatomical drawing is going to look like this. Sometimes they'll look like this or this. They'll basically be cut in half or cross-sectioned. And each cross-section or plane has a different direction and it has a different name. And those interact with the directions in the body so that when you're looking at an anatomical drawing, you can understand what direction you're looking at it from and what way it's been cut. So to learn about that, we need to start off with their body. No, not that one, this one. And the first section we're going to learn about is called a sagittal section. And it runs down the center of the body along the superior inferior axis. And it divides the body down the midline. So a strict sagittal section would look like this, right in the middle. And then anything to the left or right of that midline is called a parasagittal section. The main thing is to get the direction of the sagittal section. And you can see what it looks like as we go back and forth through this movie there on the corner of the screen, that you can see the sections as we go move the line back and forth. Okay, the next section is also runs inferior to superior, but this time the cut is made from the side. And this section is called a coronal section. That's a coronal section. So the line is superior to inferior, and the cut's made from the side, and you can see what the sections look like in the little movie at the side here as we go through, forward to backwards, posterior to anterior in the body. Now the next section is called a transverse section, and it pretty much divides the body in half. Anything that goes across the midline of the body, you'll see this described as a horizontal section, or an axial section, or an axial plane. It's all the same thing. We're just going to call it a transverse section. And it can be pretty much anywhere up or down the body, anything that cuts the body across. That's a transverse section, and you can see what the sections look like as we go up and down the body. And the last section is called an oblique section. And you won't see it that often, but I'll just tell you about it just so you know. It's quite similar to a transverse section, it's just at an oblique angle. So it's very similar to a transverse section, it's just at an oblique angle, and it's called an oblique section.